It's so wonderful and so nice to see all of you all here this evening. And it's always nice to see your faces, even via Zoom. And we miss seeing each and every one of you. And I want to welcome you. I want to welcome all the members of ASB who are with us and all the Baron Hirsch members who are with us to what's really, I think, going to be a very special evening. Not only is our hearts and our minds focused so much on the challenging times that we're living in, and we're thinking about the news, in particular the news that just came out this week about the vaccine. So we have an incredibly timely topic to study and to learn more about tonight. But on a very personal level, it feels really, really special to be able to welcome home, albeit virtually, Rabbi Shamai and Sharon Grossman back to the Baron Hirsch campus, albeit just, virtually. We do hope that you do come back in person when this is all over and come and visit, because it would be wonderful to see both of you. And it's really just such a treat for all of us to see you and to learn with you. And I want to invite my dear friend, Rabbi Joel Finkelstein, to actually formally introduce the Grossmans. What you might not know is that while at Baron Hirsch we have a deep connection, obviously, to Shamai growing up, Shamai spent some pretty formative years with Rabbi Finkelstein as roommates over the years as well. So with that, I want to turn it over to Rabbi Finkelstein to introduce our speakers and get us rolling this evening.
Thank you so much, Roy Lairfield, and it's a pleasure to be here. And welcome to everyone, wonderful august bunch here today. And it's really a great how everyone came out for this special occasion. My special greetings from Memphis to land of Israel, to Ra'anana, to my good friends Shamai and Sharon Grossman, Rabbi Shamai and Doctors Grossman, Dr. Galper Grossman, on this special occasion. And really, they're very qualified to speak about tonight's topic of the vaccine, the COVID vaccine and Halacha. Sharon originally wrote an article in Tradition last year about a different kind of vaccine, but raised many of the issues about vaccines and Halacha in the Orthodox community. And Shamai and Sharon have recently published a wonderful article about the COVID-19 vaccine in the Lair House discussion as well. Yes, I was a roommate with Shamai, and I was very close with him at the time when he got married. I was at his wedding, and I actually would have come to Memphis many times for Simchas Torah, like all my other friends, but my mother wouldn't let me get in the car. It was too dangerous to drive all the way to Memphis, so I never made it to Memphis till I came to Anshe Sfard. But alas, that was it was a great time. We were in Gush together. We were in YU together, and then during graduate school we roomed together as well. And we've always kept in touch, and it's great to see them. They have a wonderful, wonderful family, a large family, beautiful family, and they've had a number of weddings. I can't keep up with all the different weddings they've had recently. Ken Yerbu continue to have a lot of joy and smachot, and we continue to have a lot of nachas from all the children. Shamai Grossman is a doctor and a rabbi. He is a vice chair of the Healthcare Quality Harvard Medical Faculty Physicians and Beth Israel Deaconess Medical Center. He is associate professor of medicine and emergency medicine at Harvard Medical School. He's done a lot of work on emergency medicine, and a visiting professor at Shari Tzedek Medical Center. You may have figured out, he lives in Israel and also works in the United States as well. He has smicha from Yeshiva University, where we studied together, and also a master's degree in medieval Jewish history from the Bernard Revel Graduate School, where we studied. He is the author of over 200 peer-reviewed publications, amazing, and 4 books, including Ethics in Emergency Medicine, and Sharon Galper, MD, and also master's in public health, is a radiation oncologist and former faculty member of the Harvard Medical School, where she also obtained a master's in public health. She's a graduate of the Morot Halacha program, so she had sort of a second career after, in addition to her medical career. She then had another career as well as for the Morot Halacha program, a women's advanced halacha program at Matan HaSharon. You may have heard of Matan. This is the branch in HaSharon. She writes and lectures on women's health and halacha, and teaches for Matan, Machon Pua, and the Eden Center, where she's director of community health programming, the preparation and publication, etc. And Shamai Grossman, yes. So we have two eminently qualified people who, both from a Jewish perspective and a medical perspective, are eminently qualified to speak about this topic, and have already written so much on it. So really privileged to have them, and to have them back here in Memphis as well, albeit virtually, is a great privilege. This time we call on them to share with us about the COVID-19 vaccine and the halacha.
Okay. So, all right,
Thank you so much for welcoming us. This week we read Chayei Sarah, literally the life of Sarah, which paradoxically is the basis for mourning in Judaism. My father, Zecher Tzadik V'Kadosh Livracha, of saint memory, we frequently iterate in Judaism, in sharp contrast to Christianity, we abhor death and celebrate life. Avram comes both to offer hesped and to cry. Why does Abraham both mourn and cry, does the Torah tell us? For mourning is for the dead themselves. Life's purpose must go beyond our finitude, my father writes. Here in Memphis, with both Anshe and Baron Hirsch tonight, I am reminded of my father's dreams as I see their fruition in the vibrancy of this shul and of this community. I see it in so many of the individuals who I grew up with here with us tonight. I see it in your phenomenal rabbanim that lead this community. How I enjoyed sharing a few moments with you on the phone this past Sunday, Rabbi Lehrfield. Your kindness, your warmth, your appreciation, your love for this community was apparent. How fortunate am I to have one of my oldest and closest friends here in this room, Rabbi Finkelstein, and remain a sagacious mix of sincerity and scholarship. It's an incredible tribute to my father to have all of you here on the Zoom tonight. So let's play tribute together to his memory in the way he would have wanted us to. Let's talk about sustaining life within the parameters of Torah and Judaism. To facilitate this learning, I would like to take this opportunity to help realize another of my father's dreams, women's learning at the highest level. Over the past 5 years, Sharon, as Rabbi Finkelstein mentioned, has had the good fortune to study intensely in the Moral Halacha program at Matan, under the guidance of Rabbi Malka Bina and Rabbi Shani Tarragon. To showcase this learning, she and I will engage in a dialogue, and with this format, we hope to join all of you in this process. Feel free to message us within the chat, but we'll ask you to hold the responses until the end, when I hope to catch up with many of you.
So for me, it is also very, very personally meaningful to be with you tonight. Memphis has always felt like our home and where our family is. So thank you for having us. I'd like to begin with a short vignette. I'd like to tell you about Rachel. Rachel is standing at the check-in counter in Newark Airport for a United flight from New Jersey to Florida. She's with her 5 young children. And the United Airlines representative asks her for proof of COVID-19 vaccination. And she says, I don't have proof of vaccination. I didn't vaccinate. The clerk says, I'm sorry, we can't allow you to board the plane without proof of vaccination. And Rachel then proceeds to explain that she didn't vaccinate because the vaccine was designed at warp speed, because there was no long-term side effect data. And she and her children begin to cry. And she tells the clerk, she tells the representative, I haven't seen my parents in 2 years. They haven't seen this new baby in my arms. Please, is there anything you can do? And the airline representative says, we're very sorry, but this is our company's policy. Now, when a COVID-19 vaccine is available, this scenario will likely recur throughout the day in a variety of different circumstances to us. Our workplaces might require proof of vaccination to allow us in. Schools might require proof of vaccination. Places of leisure, to go to a sporting event, you might need proof of vaccination. To board a plane, you most certainly will need to show proof of vaccination. Emirates Airlines already requires proof of a negative COVID vaccine to go on an airplane. And so this is really a potential reality for all of us.
Israel's Ministry of Health has announced this week it plans to mandate vaccination. the eventual vaccination will have limited impact on the pandemic if people do not consent to be vaccinated. Surveys from several countries indicate that a large percentage of the population say they will refuse the vaccine. In the United States, in May, a survey showed that 65% of people would agree to be vaccinated, 35% would refuse. But then the Pew Foundation repeated the study in September and found that the refusal rate in the United States had risen so that only 51% were currently vaccinated, leaving 49% as refusers. In a similar study from the United States, among those who said they would take the vaccine, 14% said they would be among the first, 33% would only vaccinate after others do so, while 32% would wait for most people to be vaccinated. Only 38% would agree to a COVID-19 vaccine for their children, even though more than 90% of children are routinely vaccinated against childhood diseases in the United States. Surveys conducted in the United Kingdom and France, here in Israel, report comparable rates of COVID-19 vaccine refusal. In contrast, when you think about the polio vaccine, which was prepped to be released in 1954, 60% of people at that time said that they would accept the vaccine. Nevertheless, after the vaccine came out, the vaccine rates soared. So it's not clear whether this early data that we have about COVID-19 vaccine would translate into reality once this vaccine is released. So why do people refuse vaccine? Or why are they saying they won't take this COVID-19 vaccine? So some people say, well, they're concerned that the vaccine was developed too quickly. They're worried that there's inadequate long-term data regarding its safety. And then there are some people that just have a distrust of science, distrust of big pharma or authority, and whether it be governmental leadership spanning multiple countries, whether it's across multiple continents. And there are also just those people who entertain conspiracy theories. So Sharon, tell us, why is this vaccine so critical?
So there's several reasons to vaccinate, including to prevent personal infection, to prevent me from becoming infected, to prevent Rachel from becoming infected, to prevent others from becoming infected, and of course, to help achieve herd immunity.
So Sharon, what's herd immunity? I've heard that term. Tell us more about it.
So herd immunity is an epidemiological phenomenon by which if a certain percentage of the population develops immunity to a pathogen, to a virus, then the remainder of the population that does not have immunity is very unlikely to become infected. And in that way, the virus becomes extinct. And there have been various different theories about how to achieve herd immunity from COVID-19. So the Swedish model has been to just allow for natural infection and people will develop natural immunity. And I think that there's a strong consensus that that approach has failed. Sweden, 8 months into the pandemic, only has a 7% rate of immunity, which means that it would take a very long time for Sweden to achieve herd immunity with a tremendous loss of human life. Sweden has one of the higher death rates in the world. And so at this point, there's a consensus that we will only achieve herd immunity from COVID-19 through a vaccine. Scientists, though, disagree over the minimum level of immunity required to achieve herd immunity for COVID-19. But everyone agrees that there is no maximum threshold. The more people who are immune, the lower the risk of infection for everyone.
So if a vaccine is critical and many people will refuse, how would Halacha approach an obligation to COVID-19 vaccination, particularly one which has no long-term safety or efficacy track record? Can Rachel just subject herself to risky therapy? Would Halacha permit the vaccine? Would it obligate the vaccine?
So let's start with the question, how does Halacha approach dangerous medical therapy? And I'd like to share my screen with you, with everyone, but apparently I am not able to do that at the present time. Is it possible to?
Yeah, why don't you try now, Sharon? You should be able to do it.
Okay. Oh. So any discussion regarding how halacha approaches dangerous medical therapy begins in Masechet Avodah Zarah, Daf Kaf Zayin Amud Bet. And the question under discussion is, when may someone visit a pagan doctor? And what's the concern about the pagan doctor? Well, the concern about the pagan doctor is that he might kill the Jewish patient. And so the Gemara explains, Vaday meit mitrapin mehen. If the Jew most certainly will die, then he may go to the pagan doctor. But the Gemara asks, how could that be? We know that Judaism places tremendous value on human life. And if we allow this individual to go to the pagan doctor, the doctor could kill him immediately. How can we allow that? He still has some time to live. And the Gemara answers, we dismiss this remaining time he has to live in the hopes that the pagan doctor might help him achieve a long-term cure. And the Shulchan Aruch codifies this principle into law that someone who has a very limited time to live may see a pagan doctor. And so halacha would permit someone who is quite ill, who is terminally ill, to receive dangerous medical treatment.
Can we extrapolate the care of the terminally ill to disease prevention in a healthy individual? Are there halachic precedents to allow a healthy person to receive a dangerous vaccine?
So in fact, there are. In 1785, Rav Avraham Nanzig authored a book called Alei Trufa, and he dedicated this book to the memory of his children who had just succumbed to smallpox. And the book deals with the pressing contemporary halachic question of his time. Was it permitted to engage in a treatment that was the rage in London, described as variolation? And what that involved was taking a healthy individual, making an incision in his skin, and exposing him to a weakened version of smallpox in the hopes that he would achieve immunity without developing the full-blown version of smallpox. And this procedure was associated with a 1 in 1,000 risk of death. And Rav Nanzig permits the treatment. In fact, he says it's a great mitzvah, and that one can dismiss this 1 in 1,000 risk of death associated with the procedure because the benefit is so great. And then he presents a witness who testifies that the Rif, Rabbi Yitzchak Alfasi, permitted a very primitive form of variolation in Morocco. And what did he permit? He allowed a child who was recovering from smallpox to hold raisins in his hand, warm them in his hand, and then distribute them to healthy children so that they could be exposed to a weakened form of the disease. And clearly, according to this witness, the Rif permitted this intervention. Then in 1796, Edward Jenner discovered the smallpox vaccine. And in the early 19th century, Rav Yisrael Lifshitz, in Tiferet Yisrael, his commentary on the Mishnah, addresses the question, may one receive the actual smallpox vaccine? And he writes that one is permitted to receive the smallpox vaccine, though the vaccine is associated with a 1 in 1,000 risk of death. Why? Because the risks of infection are so much greater than the risks of the vaccine. And he cites a proof. His proof is the Beit Yosef, who quotes the Yerushalmi, the Gemara Yerushalmi, that an individual is obligated to place himself in a possible danger to save his friend from a definite danger. And what is the scenario that the Gemara is talking about? Well, the classic example, you're standing on the banks of the Mississippi River and you see someone drowning. According to the Yerushalmi, you as a bystander would be obligated to place yourself at some level of risk and jump in and save that person. But Tiferet Yisrael points out that it's not certain that the person in the Mississippi River will drown. It's possible someone else may be walking by and may walk by and jump in and save him. And so he reasons that if if we are obligated to place ourselves in a possible danger to save someone else from a possible danger, then certainly it would be permitted for a healthy individual to place himself in a possible danger by taking a potentially dangerous vaccine to prevent a potential infection in the future. And so Tiferet Israel suggests that we approach disease prevention the same way that we approach treatment of active disease, that the two are essentially equivalent. And he permits a healthy individual to receive a vaccine with a 1 in 1,000 risk of death for a disease he does not have and may never develop. And so based on Tiferet Israel, virtually all modern poskim permit vaccination against routine childhood diseases, and many even obligate it.
So if Judaism permits and maybe obligates vaccination, can we utilize this precedent to Rachel's case about a potentially dangerous vaccine given to a healthy person for a disease she may never catch?
So to answer that question, let's apply the Tiferet Israel's model to COVID-19. What are the Tiferet Israel's criteria? Criteria is that the risk of infection is far greater than the risk of the vaccine. And what do we know about the risks of COVID-19 infection and the risk of a vaccine? Well, the mortality from COVID-19 infection in the United States is somewhere above 1%. And in Israel, it's somewhat less than 1%. However, these numbers don't fully capture the true dangers of COVID-19 infection. We've heard a lot in the news recently about long COVID, and that COVID-19 infection, many people who have been infected and who have been hospitalized have persistent symptoms for many months after infection. They might have brain fog, they might have chronic fatigue, they might have loss of taste and smell. But more worrisome, more frighteningly than this, there's a large percentage of people who have persistent respiratory problems that can be potentially life-threatening, heart issues, heart dysfunction, myocarditis, stroke. So really, the risks of COVID-19 are far potentially greater than that 1% risk of death. But even if we take the conservative estimate of 1% risk of death, the risks of infection are likely far greater than the risks that could be associated with a potential vaccine. It is implausible that a democratic government would approve a vaccine that has even a 1 in 1,000 risk of death. So the benefits of preventing infection are far greater than the potential risks of a vaccine.
So, but how can we tell whether a COVID-19 vaccine developed in 2020 is safe? It's by a long shot the fastest vaccine to ever have been developed. The fastest to date, I believe, was about 4 years. In fact, the HIV vaccine we've been working on for 30 years, and we still don't have a vaccine. What safeguards are in place to ensure that this vaccine is safe?
So let's start with what safeguards in general are in place to ensure vaccine safety, and then what added steps are being taken to ensure the safety of a COVID-19 vaccine, which is, as you mentioned, being developed at record speed. So in general, vaccine development, it has 3 stages. In phase 1, about 15 subjects receive the vaccine. And the purpose of a phase 1 trial is to test the vaccine safety. In phase 2, 30 subjects are enrolled and they receive the vaccine to test for the vaccine's efficacy. In phase 3, roughly 4,000 subjects are enrolled, and they're randomly assigned to either receive the vaccine or a placebo, but they don't know what they've received. They don't know, the manufacturer doesn't know, and we follow them. We follow them for a certain amount of time to determine, to compare the rates of infection and the severity of infection and the presence of side effects, adverse effects between the 2 groups. And at some predetermined time, a data safety monitoring board, which is composed of scientists who are independent of industry, who are independent of the government, will sit down and unblind the data. They'll look at what happened to each group. And one of three things will happen. Either the scientists will determine that the rates of infection or the rates of adverse events in the group that received the vaccine are so high that the study has no merit, the study should be shut down. This happened with a recent HIV trial in South Africa. Or they'll decide that the data is worth further investigation, the trial should continue, or they'll decide the data is so compelling that the company should apply to the FDA for approval. And once the company applies to the FDA for approval, another independent board of scientists will review the data to determine its merit, to determine whether the vaccine should be approved. And they will do this in public debate, so that we as the public can listen, and outside scientists and us, and as a society we can hear what the information is. And once the FDA approves a vaccine, then the vaccine and its data go to the Center for Disease Control, where again another independent board of scientists reviews the data. And again, all of this information becomes public record for all of us to look at. Now, in addition to the traditional steps, several steps have been taken to further ensure the safety of a COVID-19 vaccine. So, for example, the Johnson & Johnson vaccine uses a platform to deliver the vaccine, which has been previously used for delivery of an Ebola virus. And this platform has received approval from the European equivalent of the FDA. It's been used in hundreds of thousands of individuals. And so we have extensive data regarding the safety of the vaccine platform for the Johnson & Johnson trial. The COVID-19 vaccine trials that are underway are enrolling huge numbers of patients. More than 10 times as many as a traditional vaccine study. Johnson & Johnson plans to enroll 60,000 volunteers. Pfizer is enrolling between 40 and 50,000 volunteers. Moderna's enrolling 30,000 volunteers. So we will have a huge amount of information, a huge database of information regarding the safety and efficacy of these vaccines. In addition, the Data Safety Monitoring Board for these trials there will be a central data safety monitoring board for several of the trials, which has tremendous benefits, because that means that if there is a side effect that is seen in one trial, the Data Safety Monitoring Board will know to look for it in another trial. Pfizer will have a separate data safety monitoring board, which also is important because, again, the more scientists who look at the data, the better. The FDA has required a 2-month wait between the last person who's vaccinated and when these companies may apply for FDA approval, to allow time for the development of side effects, to make sure that we have a chance to determine, are there any, or these companies have been incredibly forthcoming in an unprecedented way regarding their vaccine protocols, when they will perform an interim analysis, what their criteria are for interim analysis, which doesn't take place in a typical vaccine trial. And finally, they've also fully disclosed when there was an adverse event. AstraZeneca went public with an adverse event. Johnson & Johnson went public when they experienced adverse events. And this just doesn't happen in typical vaccine development. Once a vaccine is approved, the states of New York, Rhode Island, and Illinois have announced that they will independently review the data before releasing the vaccine to their citizens. And so Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Disease, and perhaps the senior scientist in the United States who has followed vaccine development, been instrumental in vaccine development, has said that between the I see a very important question that came in that we need to address that question. that between the Data Safety Monitoring Board and all the evaluation by outside scientists, there is very little room for hanky-panky in this vaccine. And Dr. Dan Baruch, one of Shamai's colleagues at Harvard Medical School, who's been instrumental in developing the Johnson & Johnson vaccine, has said that this vaccine will be the most heavily studied vaccine in the history of vaccines. And so what can we say about, what will we know about the risks of the vaccine once it becomes available? So based on the huge number of people enrolled in these trials, we'll be able to say with certainty that the vaccine does not cause an adverse event in 1 in 1,000 individuals, and likely be able to say with reasonable certainty that it does not cause an adverse event in 1 in 10,000 individuals. However, at the time any vaccine is released, it is impossible to determine whether it will cause, we just don't know whether it will cause a side effect in 1 in 100,000 individuals or 1 in a million individuals, because vaccine needs to be given to millions of people before we can have that information. And also, we don't know whether it will cause an adverse event long term. However, a review of over 1,000 vaccine studies indicates that vaccines rarely cause long-term adverse events. And if they do, on the order of 1 in a million. And so the risk of long-term side effects here is quite low, and certainly well within the range of 1 in 1,000 permitted by the Tiferet Israel, and much, much less than the risk of COVID-19 infection. And while it's personally comforting to know that, to have absolute certainty that the vaccine does not cause side effects, or if it does, on the order of 1 in a million, Halacha would likely dismiss these very rare side effects because they're comparable to the side effects that we see with traditional vaccines, routine vaccines of childhood, which are mandated by most governments and which Halacha accepts.
So let me ask you this. What if I wait 4 months? So how did I get to 4 months? So 2 months after the vaccine is potentially developed, 10, 20 million people will have received the vaccine. And then I'll wait 2 more months just to look at outcomes.
So that's an excellent question, and many people I've spoken to actually say, you know what, I'm just going to wait. I'm just not going to be the first to do it. I want to make sure that it's safe, and I understand, and that's a legitimate concern, and it's a legitimate desire. But on the other hand, we need to balance the fear that the vaccine might have long-term side effects that we don't know about, that the vaccine might have very rare side effects, against the reality that every day that we wait to vaccinate, the pandemic continues and 1,000 people in the United States die. If we wait 6 months, we know that 500,000 people will die worldwide. And so we need to balance between this fear of very rare side effects and the reality that the decision to wait will have a tremendous cost in human life.
And I guess practically, unless you're a healthcare provider, you're probably not going to get the vaccine for a couple months anyhow. So you're really going to have data on millions of people, far beyond what will be released when the vaccine actually is released. So let's ask you this. How effective should the treatment be for Halacha to justify the sakana, to justify engaging in risky behavior?
So poskim disagree about the minimum efficacy that the treatment must have to permit someone to undergo a risky treatment, to permit incurring such a high level of risk. And they require a minimum of efficacy as low as a treatment that cures 1 in 1,000 individuals to a minimum efficacy of 50%. However, these poskim are discussing a situation where someone is already ill. And it's not, can we actually extrapolate from the situation where someone is already ill to a vaccine that is being given to prevent disease, a vaccine that's being given to a healthy individual? Tiferet Israel suggests that we treat disease prevention much as we treat treatment of active disease. And so the question is, how does a COVID vaccine fit into these parameters outlined by Poskim? And so the FDA has said that it would require a minimum efficacy of 50% to approve a vaccine. Dr. Fauci has said that he would like a minimum efficacy of 75%. And the wonderful news that we received this week from Pfizer, their preliminary data, that the vaccine is 90% effective, is well above any of the ranges required by Poskim. Now, it's quite possible that because there's 7 billion people on Earth and Pfizer can only provide 1 billion doses of vaccine, that we might not receive the Pfizer vaccine, and we might receive a different vaccine with somewhat less efficacy. But whatever that efficacy is, it will be well above the 50% required by Poskim.
So sounds like Rachel is allowed to get vaccinated according to Halacha, but does Halacha obligate her to do so?
Yeah. So the risk of vaccination for her is well below the risk of infection, and the vaccine would have sufficient efficacy to permit her to receive the vaccine.
So, but are there reasons to compel her?
I'm not hearing you.
Can you hear me now?
I'm not hearing you.
Sharon,
I'm not hearing you.
You hear me now? Okay, so the question is, it's a long way from the upstairs and downstairs to our home. So the question is Rachel obligated? Does Halacha obligate her at this point? You've proven that clearly Halacha permits vaccination. At least you've proven it to me.
So many of the halachic principles which obligate vaccination in general might obligate Rachel to undergo COVID-19 vaccination. So, for example, Rav Shlomo Zalman Auerbach, who's Rav Yitzchak Zilberstein quotes Rav Shlomo Zalman Auerbach, who explains that public perception of danger creates a halachic obligation to vaccinate. And with 51% of the public believing that failure to vaccinate against COVID-19 is a sakana and is a danger, that perception would obligate us to vaccinate. Rav Elyashiv has issued a very strong statement regarding vaccination in a lengthy discussion he had in his home with Rabbi Hpv Vaccine. Rabbi Tatz describes this discussion in his book, Dangerous Disease and Dangerous Therapy. And an email exchange I had with Rabbi Tatz confirmed that, in fact, this conversation took place. And Rabbi Tatz asked Rav Elyashiv whether a family was obligated to vaccinate their child against whooping cough. And Rav Elyashiv answers emphatically yes. And Rabbi Tatz asked him if the reason behind this ruling was the issue of fairness and obligation to share responsibility. I'll actually read the entire quotation because it's very powerful. Rav Elyashiv makes a very strong statement regarding vaccination and raises several issues that I hope we will get to in the course of our discussion tonight. Rav Elyashiv indicated that it was an issue of fairness, the obligation to share responsibility. His reason was that since immunization of children is normal practice throughout the world, one should follow that normative course. In fact, Rabbi Elyashiv went so far as to assert that failure to immunize would amount to negligence. Refusing childhood immunizations on the basis of unsubstantiated fears of vaccine side effects is irresponsible and out of order halachically. The danger of precipitating epidemics of measles, poliomyelitis, and other diseases with potentially devastating complications is far more real than the dangers attributed to vaccines on the basis of anecdotal claims. Until objective evidence to the contrary accrues, the halakhically correct approach is to do what is normal. In addition, a legitimate government's legislation concerning standards of medical conduct adds weight to their halachic acceptability. So for the purposes of our discussion right now, Rav Elyashiv cites two reasons that one is obligated to vaccinate in general. And the first is the obligation to follow normative behavior. And the second is the obligation to follow the legislation of a legitimate government. And so when COVID-19 vaccination becomes normal, becomes normative behavior, we would be obligated to vaccinate. And when legitimate governments legislate vaccination, again, that decision to vaccination obligates us to vaccinate. Several Israeli rabbis, led by Rav Yosef Carmel, the head of Eretz Chemda, Rav Moshe Ehrenreich, Rav Yisrael Rosen, Rav Nachman Rabinovich, issued a statement regarding the obligation to vaccinate in general. And they argue that the recommendation of physicians creates a halachic obligation to vaccinate. They quote Rav Aviner, who writes, when the majority of doctors in the world state emphatically that one must vaccinate, and not just some of the doctors, but almost all of them, this becomes halacha. Lachen zu halacha. B'kach nigmar hadiyun. When they recommend this, this becomes the halacha, this becomes Jewish law, and with this, our discussion, our debate ends. Zu halacha, kol halacha. This is the law like any other law. And even more so because we know chamira sakanta me'isura. We know that we rule more stringently on dangers than prohibitions. And so when the doctors internationally, either in the United States or throughout the world, recommend vaccination, that creates a halachic obligation to vaccinate. Rav Aviner, though, raises the issue that we're all too familiar with: what happens when some doctors recommend to vaccinate and some doctors don't. And Rav Aviner suggests that in that situation, we follow the majority of physicians, but not just the majority. When the overwhelming number of doctors in the world recommend vaccination, not just in Israel, but in Europe, the United States, and the World Health Organization, that obligates us to vaccinate. And so when the World Health Organization endorses the COVID-19 vaccine, that creates an obligation for us to vaccinate. Other reasons to vaccinate are dina de malchuta dina, the notion that the law of the land is the law of the land. And if the government mandates vaccination, if the Israeli government mandates vaccination, that mandate obligates me to vaccinate. And of course, the desire to prevent a chilul Hashem. We've all seen, we've all watched in consternation with tremendous pain, the recent measles epidemic, which spread in the Orthodox community and really took place because many refused to vaccinate. And so if the government mandates vaccination and Jews refuse to not vaccinate, creates a chilul Hashem. And so public perception of danger, the obligation to engage in normative behavior, to follow the recommendations of a legitimate government, of physicians and physician bodies like the World Health Organization, dina de malchuta dina, and the desire to prevent chilul Hashem would all obligate us to accept a COVID-19 vaccine.
Well, we're in a pandemic now. Does that change the rules of obligation? You're still not hearing me, huh?
No,
So
but can everyone else hear you?
We're in a
Can
pandemic
people
now.
hear
Does that-
Shamai?
Yes.
Right.
Okay, so fine. So
So I simply asked, does a pandemic change the rules of obligation?
excellent question. The poskim whom I just cited all obligate vaccination in normal circumstances, not in pandemic situation. And so logic would dictate if we have an obligation to vaccinate under normal circumstances, the obligation to vaccinate during a pandemic is magnified. And this in fact is suggested by various poskim. So the Rama in his gloss on the Shulchan Aruch explains that in the midst of a pandemic, one is obligated to evacuate a city. In the midst of a plague, one must evacuate the city, but not at the beginning, at the end of the plague, but at the beginning when the disease burden is the least and the chances of infection are the smallest. And Rav Asher Weiss, who quotes the Zivchei Tzedek, explains that the contemporary equivalent of evacuating the city in the midst of an epidemic is vaccination. And so when there's a pandemic, we are no longer obligated to escape. I don't need to run away, to run from Renana to go to New Zealand. But what must I do? I must vaccinate myself and my family. The Rav Herzog, the former chief rabbi of Israel during the British Mandate and during the establishment of the State of Israel, explains that the rules of vaccination change in the midst of a pandemic. He was asked whether it's permitted to undergo vaccination on Shabbat when there's an epidemic nearby. It hasn't yet reached our community. It's still in Wuhan. May I vaccinate on Shabbat if the doctors are concerned that delay till after Shabbat will be dangerous? And he permits vaccination on Shabbat. And he likens a situation to a city in Israel that has not yet been attacked, but that our leaders fear will face attack, and our leaders recommend fortifying the city during Shabbat. What happens if we know that the attack on Jerusalem is imminent? And he explains that the situation is that of a chola sheyesh bo sakana, a sick person who faces a life-endangering disease, which is considered a situation of pikuach nefesh. And so just as we are permitted to fortify the city against the potentially invading army, we are permitted to vaccinate against a disease that has not yet reached us but is imminent. And so if we are permitted to vaccinate on Shabbat for a disease that hasn't reached us, how much more so is our obligation to vaccinate once the virus is in our midst, reached our homes, and reached our communities.
So the world will reach herd immunity. Why can't I just wait and allow others to vaccinate? Eventually, I will no longer be at risk for infection.
So actually, this is something that Rachel has discussed extensively with her friends. She says, why do I need to vaccinate? The world will reach herd immunity without me. Nobody needs me to vaccinate. Why do I have to put myself through that risk? And Rav Asher Weiss strongly denounces this approach. He explains that each one of us is obligated to contribute herd immunity. If everyone took that approach, we would not achieve herd immunity. The pandemic would rage and it would continue. And he learns this from the example of the Noahite generation, Dor HaMabul, where people would steal. They'd take one onion, they'd take one apple, things that had value that was less than a pruta, that would not even be considered theft. And so if one person did this, society wouldn't suffer. But if everyone did this, the merchants couldn't go on, they'd have nothing. And he argues that whatever is prohibited for the group to do is prohibited for the individual to group. And then he explains that each one of us has an obligation to contribute to issues of public safety. He cites the example of Baba Batra, where every citizen is obligated to contribute to the construction of a wall for the fortification of a city, even an orphan, even a poor person. And so each one of us is obligated to contribute to herd immunity. And Rav Elyashiv, as you've already seen, has said that contributing to herd immunity is an issue of fairness. A statement issued by rabbis and physicians in Lakewood regarding vaccination in general, measles vaccination, is that sharing these risks equally to protect the klal is a communal responsibility. It's selfish to expect others to bear any risk of immunizing, no matter how minor, while taking advantage of the community-wide immunization that protects one's unimmunized child. And so for Rachel to decide, I'll let everyone else vaccinate to achieve herd immunity, the world doesn't need me, is unfair. It's somewhat selfish, and it shirks communal responsibility.
So Christianity has this idea, it's a New Testament idea. It's that there is something called the Good Samaritan. Does Judaism recognize this obligation of altruism? Do I need to worry about the person down the street who I don't even know?
So perhaps the most compelling reason and the most critical reason, halachic reason to vaccinate is the obligation to protect others from infection. The Gemara Sanhedrin Daf Ayin Gimel Aleph Aleph asks, from where do we know that if someone is chasing after our friend, we are obligated to jump in and save him? Talmud Lamar, Lo Talmud al Damriyacha. We learn this obligation from Lo Talmud al Damriyacha, do not stand idly by. And the Sefer HaChinuch explains that this obligation exists at all times for all people, for men and women. And what's the reason for this obligation? Well, if you save me, I'll save you. And in this way, the world will be saved. Rav Carmel and the rabbis who joined him in his statement regarding vaccination explains that one of the most compelling reasons to vaccinate is to prevent others from infection. And in fact, someone who does not vaccinate is considered a rodef, a pursuer, someone who is actively chasing after others in an attempt to kill them. How could that be? Well, if I become infected with a virus, I become infected with COVID-19, I could infect someone else who is immunocompromised and cause that person to die. Or I could be admitted to an intensive care unit and take up a bed that could go to someone else who will die if he doesn't receive that bed. And so Lo Talmud al Damriyacha obligates us to take steps to prevent others from becoming infected, whether that means social distancing, wearing a mask, exercising hygiene, meeting people outside, trying to limit our exposures to others, and also to vaccinate.
So how much risk do you need to entail to save someone else?
So that is a critical question.
Go ahead. I hope you're able to hear it. Good. Go ahead.
We have to apologize to everyone for these technical difficulties. We spent an hour today going from room to room in the house with different computers, different devices muted to try to get it just right. So really, we truly apologize for any technical issues. So that is a critical question that you raised. Does Lo Talmud al Damriyacha apply even if there is a risk to the rescuer? Is Rachel still obligated to vaccinate to protect others from infection if the vaccine is potentially dangerous for her? So we've already seen the kernels, the key source in this answer, which is the Beit Yosef, cited by Tiferet Israel, and Beit Yosef, as you said, quotes the Gemara Yerushalmi, which obligates one to place himself in a possible danger to save someone else from a definite danger. And interestingly, Rav Yosef Karo does not codify this position to halacha in the Shulchan Aruch. He does not mention an obligation, and that is because we also rule chayecha kodmim. Your life takes precedence to someone else's life. And so if rescuing poses a risk to the rescuer, does Lo Talmud al Damriyacha still apply? The Rav Avadia Yosef addresses this question in his tshuva regarding kidney donation. And he cites the Radbaz, who really defines three different scenarios for rescuing. In the first scenario, the risk to the rescuer is tremendous. And in that case, rescuing the person in danger is asur. In the second scenario, we're talking about a safek shakul, a 50% risk to the rescuer, in which case rescuing is not asur, it's permitted, and it would be considered a mitzvah of Lo Talmud al Damriyacha. In the third scenario, there's ktsat safek sakana. There's a small, minimal risk to the rescuer. And nevertheless, the rescuer is still obligated to place himself, to accept that small possible risk to save the person in danger. And so the Aruch HaShulchan, in his second to last siman of Choshen Mishpat, explains Hakol lefi ha'inyan, v'yesh lishkol ha'inyan plus v'lo lishmor et atzmo yoter midai. It all comes down to a numbers game. And there's certain situations where one shouldn't be too careful to protect himself from danger. And so Rav Avram Steinberg in his Harefuah Halacha explains that when the risk to the rescuer is small and the benefit, the possibility of saving is great, the rescuer is obligated to place himself in a small amount of danger to save his friend. And if he doesn't, he violates Lo Tamod Al Dabriyacha. And he bases this on the Radbaz and the very examples which the Gemara discusses to derive the examples that Gemara uses to learn, to understand Lo Tamod Al Dabriyacha, situations where there still is some risk to the rescuer. And so how do these different levels of risk apply to a COVID-19 vaccine? Well, I think that if the risks of vaccination were on the order of 90%, that if Rachel vaccinated, she'd face a 90% chance of dying, that certainly Halacha would forbid her to vaccinate. If the risk was suffix shakul and she had the vaccination associated with a 50% risk of death or somewhat less, then Halacha would permit her to vaccinate, but not obligate her to do so. But when we're talking about a ksat suffix sakana, a risk on the order of 1 in a million, or 1 in 100,000, or a risk of 1 in 10,000, or even 1 in 1,000, the risk of the Tiferet Israel, that she might be obligated to vaccinate.
Last question. How does Halacha view vaccine refusal?
So we've already seen that Rav Elyashiv refers to someone, classifies someone who refuses vaccination as negligent, that Rav Carmel and the rabbis with whom he issued his statement referred to someone who refuses vaccination as a rodef. But Halacha approaches someone in the midst of a pandemic, in the midst of an epidemic, uses even harsher terms to describe someone who refuses vaccination under those circumstances. The Ber Hetev, who addresses the Ramaz statement that one must evacuate the city in the midst of a pandemic, he refers to someone who refuses to evacuate as chayavim b'nafshotam, responsible for his life and the lives of his family. And given what Rav Asher Weiss has told us based on the Zivchei Tzedek, the contemporary equivalent of evacuating the city in an epidemic is vaccination, one could extrapolate that someone who does not vaccinate in the midst of a pandemic is chayavim b'nafshotam, held accountable for the lives of his family and those around him. Rav Mordechai Halperin, director of the Fox Schlesinger Institute for Halacha and Medicine at Shaarei Tzedek Hospital, has written that someone who refuses to be vaccinated during a life-threatening epidemic is considered a rotzeach begrama, an indirect murderer, or a mazik, guilty of a form of theft. The Agudat Yisrael has said that in the midst of a pandemic, someone who does not vaccinate is a rodef. And Haredi rabbis in Israel, leading Haredi rabbis led by Rav Yitzchak Silverstein, in response to the most recent measles epidemic, explained that vaccination is a chiyuv gamor, is an absolute halachic requirement, and someone who fails to vaccinate is a shofech damim, a murderer. So these poskim use the harshest language to describe someone who refuses to vaccinate, especially in the midst of a pandemic.
So let's summarize and conclude. So number one, we can vaccinate even though the vaccine we will receive will be brand new, as the risks of the vaccine will be far less than the risk of infection from COVID-19 and far less than the 1 in 1,000 quoted by the Tiferet Israel. We may even be obligated to vaccinate to help achieve herd immunity and obligated to help end the pandemic. Most importantly, we may be obligated to vaccinate to prevent our own infection and to protect the people around us from infection. Lastly, some halachic decisors cited today might classify vaccine refusal as murder, with the refuser as a rodef, someone who is actively pursuing one with a weapon in hand with an intention to commit murder. So in reality, Sharon, what would happen to Rachel?
Well, in my ideal world, the director of public relations for United Airlines would come out and tell her that she may personally decide that she does not want to vaccinate, and that she is willing to accept the risk of infection, but could she live with herself if she infected Mr. and Mrs. Cohen, who are waiting to board the plane, who are returning from their visit to see their grandchildren in New Jersey? Could she live with herself if she infected her parents, her grandparents? Could she live with herself if she was responsible for prolonging the pandemic?
Thank you so much for having us. It's truly an honor, a pleasure. We are so thrilled that we were able to spend some time with really our family in Memphis and our friends. Thank you so much. We're happy to take any questions you have. We're sorry we went a little bit over.
Shamai, it's Pace. What a tribute to the memory of your father and Sharon, your father-in-law and mother-in-law, that we had our biggest crowd for a scholar in residence tonight. And you guys were, no surprise to those of us that know you, extremely well prepared. And like I followed Shamai when I was an elementary and high school student, I'll be second in line behind you to get the vaccine when it's available to us, Shamai, with your leadership. And what a wonderful share.
Thank you so much. Really, thank you. It's
May
wonderful.
I make a comment?
Thank you.
Please do.
This Schlemiel doctor in England started this whole anti-vaccine thing. He was his license was taken away, and I don't know if we would be having this deep a discussion if this Schlemiel of a doctor hadn't printed what he did in a medical journal, which was classified as what a better term, BS. That it gave people what is the word that kids were getting? What's the disease? Can you senior moment here?
I think you're talking about autism, Charlie.
Yes, that's what I'm talking. Thank you for filling in my brain. Yes, thank you.
It's all right. I unfortunately I've read too much about it. And you're right. It's remarkable how someone can print something once and that idea gets propagated further and further. Sharon, you have something to say.
But it was proven that he was wrong by every other doctor in the world. Oh, not every doctor, but.
So I didn't hear the whole question, but I got the gist of it. This is a very dangerous phenomenon. Someone introduces, makes a false claim about a vaccine. Science disproves it, but then the damage is done. And a very similar scenario has taken place with HPV vaccine in Japan. A scientist published data that Japan introduced the HPV vaccine, and suddenly and over 70% of the population was vaccinated until a scientist published data saying that the vaccine caused severe neurologic side effects. And girls appeared on television in wheelchairs claiming that they had developed severe side effects from the vaccine. And Japan actually discontinued the vaccination program until one very brave reporter actually researched what happened and discovered that all of this hoopla was based on a single study in a single laboratory where a scientist injected 2 mice, one with with placebo with water and the other with HPV vaccine, and the mouse had neurologic damage afterwards. But guess which mouse had the neurologic damage? The mouse that received the sugar pill, the sugar vaccination. And at that point, the thinking that the vaccine caused neurologic side effects was completely dispelled. disproven, but nevertheless, the fear of the vaccine persisted, and Japan to this day has not reinstituted the vaccine, and 30,000 women each year are diagnosed with cervical cancer, a couple thousand die, and all of this could have been prevented, but once the damage is done, the damage is done.
Any other questions?
I have a question. For people that have a low immune system, like in my situation, I have to take steroids so my organs don't shut down, which you think I need to be first in line, but my second thought on this is that they have to put a low dose of the virus in you. And so someone who does have a low immune system, is this going to be safe, do you think?
So I'll answer the question. I can start, and then Sharon, if you have some more to add, please do. It's an excellent question, and I think it drives home the point that it's even more important for those who have intact immune systems, for those of us who are healthy, to get vaccinated, because God forbid, should one of us infect you, you are at far greater risk. And there are populations that are higher risk populations, such as those who are non-intact immune systems, people who are immunosuppressed or immunocompromised. Those populations are being studied, and there will be some data released. We'll see. Hopefully they'll have addressed exactly your question, but it certainly drives the point home that all of us who are otherwise healthy need to get vaccinated as soon as we can.
Okay, thank you. I had my speaker on, so my microphone wasn't working correctly. Okay, thank you so much.
You're welcome.
Thank you, Joan and Philip Baum. We loved it, and we miss your father very much. You did a good job. You did a good job.
It's wonderful to see you, and thank you, thank you for your words. We miss him too.
Yes.
We want to thank both Shamai and Sharon for making the time. What we might not realize, it's literally the middle of the night for them in Israel. That's just how dedicated they are to the topic, to education, to our community. And we are just so indebted to both of you for making the time and sharing with us this evening. And we pray that everyone should stay safe wherever they go and should stay well. And I know both Shamai and Sharon are around for those who want to talk for another few minutes afterwards. But again, we thank our friends at ASB, at Baron Hirsch, and wish everyone a Shabbat Shalom. And again, just encourage everyone to stay safe.
Thank you so much, Learfield. Thank you. And I'll stay on just for a few more moments, just if anyone wants to simply say hello. And I can tell you, Mr. Bells, it's wonderful to see you. And it's wonderful to see you, Jan, as well. And each and every one of you, I just want to say, may God spare you from anything, from any of the effects of COVID-19, and keep you in good health. And maybe I'll see each other in person, maybe very soon.
Standing invitation. We love it.
Thank you.
What a great class.
Thank you.
Shabbat Shalom.
Thank you, Sharon, Shamai. It was really outstanding. Thank you.
Thank you. Thank you. Thank you, Rabbi Finkelstein. Wonderful to see. Well, wonderful to see you, even if 7,000 miles away.
Yishak Kochachem. It was a wonderful share. Wonderful share.
Thank you.
It was a wonderful share, which I really enjoyed. But I have a question. There is a doctor somewhere out there who said that anyone over 75 should not get the vaccine because they probably should be dead anyway.
Oh.
They're non-productive members of society.
Oh
and
boy. Oh boy.
That was
same doctor says you should probably push them off the cliff as well.
Right. But he said that, I heard him say it. So I'm not, this isn't a rumor.
So you might remember my grandmother, Alina Zaretsky, who graced Baron Hirsch until she was 106.
Right.
And remember, they asked us at 99, she tripped and fell and broke her hip. And they asked us, well, so what do you want to do? And my parents said, without a blink of an eye, well, of course, let's go take her to the operating room. Let's repair her hip. And sure enough, if you remember, after that, she started walking with a cane to shul to Baron Hirsch every Shabbat.
Right. Mhm.
And that's really Judaism's attitude. That's really my parents' decision, my grandmother's perseverance. That's really Judaism's attitude, and that's the mindset that we need to have as Jews.
Well, actually, though, I heard last night that they're thinking of giving it to first responders and then people in nursing homes, and having other seniors who are healthy stay home and wait.
Well, I think that this vaccine will get to us sooner than we think. If it's interesting, Pfizer has committed 20 to 30 million doses of the vaccine just by the end of this year to the United States. So we'll see. But
Okay, well, thank you very much.
Meanwhile, stay healthy and protect yourself. Keep yourself as isolated as you can.
I am.
Shamai, this is Charlie. I just wanted to say how marvelous it was seeing you and your wife and hearing your great lecture. Just marvelous.
Thank you. And wonderful to see and hear your voice again.
And I think about your dad a lot too. I remember once I went up to him 40 or so years ago or more and said, "Yes, so-and-so electric razor kosher?" And he said, "They're all kosher. You can use all of them." That was the way he answered me. Anyway, take care of yourself, and Zygosunt, both of you.
Be well.
Yeah.
So, Shamai, are you going to go back to sleep, or does your day start now?
That's a good question. If I were in the States, my day would start now. Here we'll see what happens. Shachrit is at 8:30 tomorrow morning. So because Friday is Sunday in Israel.
Right.
So we at least we'll have a couple of hours.
Well, we're so lucky and appreciative. You guys are amazing. Thank you so much.
You're welcome. Be well, everyone. Take care. Shabbat shalom.
Thank you, Shamai.
And be well. Take care.
Bye-bye.
Shabbat shalom.
Shalom.
How many people were on?